Hello, my name is Chris Hill. I'm the board chair and CEO of Sindy XR. Welcome to our Wellness Journey series. In today's series, we'll be focusing on the topic of artificial intelligence and the information and how it's used now that artificial intelligence is now ubiquitous within the medical community, although there's still amazing innovation that we're still learning about as well. In Sindy XR, our focus is really working with medical professionals and their patients to really answer the question, what happens in between medical visits? You know, as physicians work with their patients around various areas, it's really important between visits that there's an interaction, there's an engagement. Sindy XR works with physicians in both telehealth as well as virtual reality modalities to really enable the physician to meet with their patients. Usually the patients have a similar condition, and in between medical visits, provide a forum, not just for information from the physicians themselves, but most importantly, enable the patients to interact with each other and ultimately learn from each other in terms of best practices, how they deal with certain situations. It's really a compounding of advice coming from the patients themselves. In November of 2024, Sindy XR launched our newest product, which is Sindy XR AI. And we've seen a dramatic increase in the ability to collect information from these group health support roundtables and provide it to the physicians involved so that they can really understand from a synthesis of artificial intelligence, the words that are used, the practices that are discussed in a much more scalable way, so that they can go from more population-based advice to specific advice that comes from the interaction with a larger group of patients themselves. So in that vein, I'm very happy to be joined by Dr. Charles Cavo, co-founder and chief medical officer of Pounds Transformation. Pounds Transformation has been an incredible partner with Sindy XR as we go into this new area. So Charlie, if you could just do a little bit of background on Pounds Transformation, then we'll get into our discussion around the AI aspect of your business.
Sure. So yes, I am one of the co-founders of a medical practice, Pounds Transformation, which is in Connecticut. And my background is OBGYN. I had been practicing in private practice for about 15 years. And during that time, my wife, who's very nutritionally savvy and finds food to be the answer to many, many chronic conditions, started seeing patients actually in our kitchen, friends and that sort of thing, just to give them education on how they could utilize food to manage things like obesity, diabetes, insulin resistance, and these kind of things. And the few patients that she saw became very successful, and she started getting referrals from other clinicians in and around Connecticut. She opened up a small office about a mile away from our house while she was raising our three boys. And one thing led to another. The practice became very, very busy. 3 practices later, and I left my medical practice, my private practice in OBGYN, and took on the role as the chief medical officer of Pounds Transformation. We've just continued to grow, managing chronic conditions, all associated with food and lifestyle. So we have about 400 physicians referring into our practice. We're partnered with Connecticut Women's Health and do an awful lot of women's health care with menopause, perimenopause, polycystic ovarian syndrome, infertility, and the such. A practice was featured on the Magic Pill documentary, which is a international documentary in Netflix. And we've just been having a good time using food as medicine, sorry for the cliche, and resolving chronic conditions which people believe they should have for the rest of their life. And we happily prove them wrong and deprescribe medicines day in and day out. And so now the practice is in an odd place where there's many, many people who want to get appointments, and there's a longer and longer wait list. And so we're looking at scaling opportunities, and we find the televideo and what Sindy XR has brought to the table to be very friendly with regards to how we plan on growing and scaling the practice. And so the journey just keeps on going, and we're just feeling like we're getting started.
It does have that feel to it that although it's been an interesting journey. Maybe you can take us back a little bit over the last 15 years in terms of how the use of technology information has evolved. But, interesting enough, even through that period, it does feel like we're on to new adventures even today. But take us back a little bit, Charlie, as you have been working with patients and collecting information. How is that collection process, that the synthesis, the understanding of what works, what doesn't work, the efficacy change in terms of data collection prior to AI? Then we can talk a little bit about the advent of AI and how that's changed things moving forward.
Yeah, I mean, I think that the technology in healthcare has just absolutely exploded. When you look back at how our practice started, and it really was, and it still is, we go into clinical rooms, we see patients, we get information and a history, we form a nice solid relationship with our patients, and they entrust us with vulnerable aspects of their health that we can then manage. Now, fast forward to the present, where coming out of COVID, I don't think many clinicians had much of an idea about telemedicine at all. And COVID really forced us into a space where we had to appreciate video conference calls and taking care of patients with computer appointments. And there's also been an explosion, Chris, with people becoming curious about their biomarkers and wearables and understanding things like heart rate variability, understanding things like continuous glucose monitoring, having devices at their fingertips and labs that can be ordered from their homes in order to see if they're getting healthier or if they're beginning to have some smoke coming out of their engine when it comes to their health. And so fast forward now to artificial intelligence, where you can actually ask smart AI questions and get great answers with regards to your healthcare. And it's almost as though AI is forming a partnership and bridging that doctor-patient relationship, because unfortunately, physicians and providers can sometimes speak up here when patients really need the information down here at a lower level of understanding. And I really think that AI in different regards can bridge that gap. We certainly have seen it and use it in all sorts of aspects of the practice. We use it for developing meal plans. We use it for having meetings. We're getting into, as you know, the virtual reality space where people who might not want to be seen in front of a doctor for different kind of reasons that prevent them from wanting to just walk through the door. All sorts of opportunities are opening because of the advances in technology and the relationship with healthcare. It's really a fascinating time, I think, to be in medicine.
It's really exciting to see how you and your practice embraces that. When you think about the one-to-one interactions that your nutritionists have, dietitians, various folks there at Pounds Transformation, what is some of the data points, some of the information that you're seeing collected that you're now looking at through an AI lens has enabled you to show better efficacy or to show better understanding of a broad patient base?
So a lot of our practice deals with body composition, and people are really fascinated by weight. What's your weight? What's your weight? What do you want your weight to be? And unfortunately, the weight is such a small piece of a puzzle of health, and it gets way too much attention, sort of like BMI gets too much attention. I think glucose gets too much attention. And so just as an example to the question that you're asking, what kind of information do we use? Well, we use body composition, and body composition gives us so much information as to what makes a person's weight up. So how much water weight, how much muscle, how much lean body mass, fat mass, these kind of things. And then from there, you can use that information in AI and start to really dial in on how to balance a person's macronutrients. Just weight alone and obesity and the problem that people have when it comes to trying to lose weight to become healthier and getting advice like go exercise more and eat less is just the wrong kind of information. It's so much more about your body's interaction with proteins, fats, carbohydrates in the environment, and using the data points like body composition, using the information from labs like HbA1c, like insulin, inflammatory markers like CRP, and putting this into AI so it can analyze the data and then help you make projections as to how to treat the patient is the direction that we've been able to go by using AI.
And that's very clear, the benefit from a physician's perspective. And I thank you for that. To take us in your experience and just your observation from the patient's perspective, right? Now that they're using wearables, they're getting this information from you and from your team. How have you seen the intake from the patient's perspective? Have you seen behavior modification? Are they, taking the information that's coming from the wearables and coming from your analysis, perhaps even other patients, and are they using that to have a better outcome?
Oh my God, totally. I mean, look, you take somebody that's really unaware and unconscious basically about their health, and they know they're suffering. They're sick and tired of being sick and tired, but they don't know exactly what the problem is. And then you start to give people education with regards to feedback from what they get to see. Let's say on a continuous glucose monitor, which is a wearable you put on the back of your arm, and then it tells you in live time how your blood sugar is doing 24/7. And so having a person start to understand that just a little bit of a food that they know might not be great, but they justify it as it's just a little bit, but then they get to actually see the metabolic results that occur from just that little bit is really a deterrent for them to go and have these kind of foods as frequently as they may, because it's impacting their health. We use things like breath analyzers that can sense the amount of ketones a person's producing if they're on a ketogenic diet. And again, some people say they're on a modified keto diet. And when you give them the device to take a look to see whether or not they're actually making any ketones at all, and they start to learn that they're not, and then they get to learn what it takes for them to actually make ketones and burn fat, is really, I think, eye-opening and creates a lot of modifications in a person's behavior and approach to lifestyle interventions that just promote health and wellness.
Excellent. And I really appreciate the learnings on that as somebody who has a center right here and learns a little bit about what works and what doesn't work, even for my own personal life. And so I really appreciate that. As you think about and look at the information that I know in perhaps years past, medical professionals would rely on studies and papers that are published out of various medical organizations and medical schools and what have you. Now we seem to be in a situation where, of course, with all HIPAA compliance and all anonymization and all that privacy in mind, but that information is being funneled into medically oriented AI engines increasingly, so that the information that you may have learned from your Connecticut-based practice may help somebody who's in Dubai or Mumbai or Beijing or Boston, wherever that may be. Are you seeing now, with your medical professional community in mind, sharing information through AI? And even though it's embryonic, I guess, at this point, how do you see that evolving where your community will benefit from the learnings you're getting from your own practice?
So there's an AI, obviously with Sindy XR, I get the AI with the interactions with people, which has certainly evolved. And we've had group meetings, which I don't think we've been able to have in the past because of AI support. We're using a company that does meal planning and recipe production using AI, and you can type in what ailment you might have, chronic hypertension or diabetes, and formulate very quickly a 1-week meal plan, which is really interesting. That information of what people like and don't like as far as tastes are concerned and what's advantageous and disadvantageous to controlling blood sugar is also somehow brought together through AI. And the ability to care for people just continues to improve through those kind of modalities.
It's very exciting, and it gives us hope as we look forward to actually looking at the data and ultimately tracking things perhaps more closely. I think obviously having wearables, various things like that, it sounds like your practice's embracement of that allows for better tracking of individual patients. So from a numeric data perspective, has that really made your practice more efficient?
Makes it more efficient, and it makes the healthcare so much better for patients. We'll use remote patient monitoring which also is something that's relatively new and upcoming. In remote patient monitoring, we can give people devices. The devices have a little chip in it, if you will, that when the person tests themselves, whether it's for a blood sugar or a blood pressure or a weight or what have you, that information that they get comes into our electronic medical record, and we can see it live time and send messages to the patients, create alert systems if there's something that has gone on that's not that's bothersome for us as clinicians, and we can make changes and adjustments very quickly in a person's healthcare. So we don't have to wait 4 weeks, 6 weeks to follow up. We can follow up with patients if we want every single day. That's amazing when you think about where we've come to, you know? So yeah, absolutely. This has made a huge difference in the way we can deliver healthcare.
So it sounds like, in summary, that you and your practice, but also your patients, have embraced artificial technology, the information, the intelligence around it, the wearables, and various other things moving forward. And the future is bright in terms of better efficacy. Is that a good summary?
Couldn't have said it any better, Chris.
Okay. Well, leave it here. Thank you, Dr. Cavo, and we appreciate the partnership.
Sure. Likewise.